It's the night before his major operation, but Mohan Patil is not worried. He's a doctor himself and he knows without heart bypass surgery he will die. But he's opted to stay awake during the operation.
I am not nervous. I am not nervous. I am not nervous at all.
10 hours later, he's in theatre. He's had local anaesthetic injected into the space around his spinal cord. It's deadened the feeling from his chest to his stomach. So even though the surgeon has broken his chest bone and is now cutting, slicing and clamping his heart, he can't feel the pain.
Here the octopus comes out. Big forceps, please, sister. Right.
His blood pressure is normal. There's no sign of anxiety and he's constantly reassured by the doctors. The technique's been pioneered in Asia by this man, Dr. Vivek Jawali, who came up with the solution for patients who are considered too high risk for general anesthesia. He's done more than 400 awake surgeries and is the first to do a combined coronary bypass and aortic valve replacement while the patient is awake. The biggest hurdle he had to overcome was the emotional.
In the beginning, yes, because the whole thing was alien in the mind. So it was only a matter of what you call reorienting yourself. It really didn't take much time, neither for me, for my colleagues. And everybody has got used to it now pretty quickly.
Mohan Patil was one high-risk patient, a diabetic with blood pressure problems. General anaesthetic would have meant he needed artificial help breathing, with a ventilator tube down his throat, a process likely to make his blood pressure soar and very risky in his condition. Staying awake negates that need. He loses less blood and the surgery is done more quickly.
The operation's been going on for 1.5 hours now. It's almost halfway through. The doctors have been talking to him throughout and he has even asked for a glass of water to drink.
Stopped, paralyzed heart.
A Chinese surgeon is observing. He's been in Bangalore for 3 months, learning the technique from the Indian surgeons so he can do it on his own back home. It's a procedure Dr. Jawali believes the West would do well to learn too.
An average surgeon in UK, I guess, would take about 10 to 15 minutes to do this anastomosis on a perfectly still cardioplegic heart on heart-lung machine with GA and paralyzed patient. And I showed you that on a beating heart, without any paralysis, without any general anesthesia, I took 4.5 minutes. My point is not to boast about my timing. My point is that with all this, you can still achieve a good, respectable anastomotic time. So it's pretty safe and technically user-friendly.
Dr. Jawali takes it all in his stride.
This is exactly like the pilots flying the plane or the bus driver driving the bus. It's no big deal. We've been doing it all the time. It's a job to take my grade home.
Slam.
After his chest has been closed up again, Mohan Patil is almost chatty.
How do you feel?
Fine.
Did you feel anything at all?
No.
And now?
No.
What can you feel in your chest?
Fine.
He's taken back to intensive care, where his condition will be monitored, but he has no general anaesthetic to wake up from. A short while later, he's sitting up and able to remember what went on in the theatre.
Can you actually remember what they did to you? Can you remember the doctor talking to you?
How are you, doc? I told I am fine.
The traditional technique would have meant he came to with a tube in his mouth, unable to speak or drink. Instead, less than an hour later, he's able to enjoy a cup of coffee.
How are you? Okay. You are a little drowsy because whatever sedation that we get.
The team's already working on another revolutionary technique, heart surgery done in a day.
So what we are talking about is totally closed chest without opening the chest. Endoscopic through the endoscopes, assisted by robots, and done awake without general anesthesia, so that patient come in the morning, go home in the night.
And see that one of the balls
go after. That means your
Breathing exercises done the following day show the patient has almost full lung capacity back.